October marks the 40th anniversary of Breast Cancer Awareness Month, and ABC's medical unit is teaming up with the American Cancer Society to give viewers the resources they need. This year's theme is survivorship, thriving after a breast cancer diagnosis. Diagnoses are going up, especially for young adults, but thanks to advances in detection and treatment, more people are living in remission than ever before, and that is tonight's By the Numbers. According to the American Cancer Society, 1 in 8 women will be diagnosed with breast cancer in their lifetime, making it by far the most common cancer for women, excluding skin cancer. Doctors advise having a mammogram every year starting at age 40 for women at average risk. And some good news, breast cancer death rates in the U.S. have dropped by 44% since 1989, thanks to increased early detection and advances in treatment. That translates into more than 500,000 lives saved since the start of breast cancer awareness initiatives 40 years ago. Researchers estimate advances in screening account for about a quarter of the drop in breast cancer deaths, while improved treatments are responsible for the other 3/4. But there still remains a difference in survival rates depending on a woman's race. Black women had up to a 50% higher risk of dying from certain types of breast cancer than their white counterparts. And joining us now for more on treatment options and the groups at greatest risk for breast cancer, Dr. Pamela Drullinsky, medical oncologist at Memorial Sloan Kettering here in New York City. Doctor, thank you so much for joining us. So let's start with detection and how it varies from woman to woman.
So mammography was first approved in the 1970s, and the technology's improved tremendously. And now we know that with dense breasts, you have to add ultrasound. In high-risk groups, we can use MRI of the breast. And the newest technology that has been approved is mammography with contrast.
And give us a sense of the treatments and how they've evolved over time.
So definitely things have improved. With small tumors, we can do surgery first. Sometimes chemotherapy and hormonal therapy is used afterwards. And with larger tumors, especially HER2 positive or with lymph node involvement, we give chemotherapy in combination with antibody treatments like Herceptin and Perjeta for HER2 positive breast cancers. And for something called triple negative breast cancer, we now have immunotherapy.
Give us a sense of the women who tend to be at greatest risk for getting breast cancer.
So as we said, mammography begins at age 40, but if someone has a strong family history, usually in a first-degree relative that's young with a history of breast, ovarian cancer, or male prostate cancer, that should alert a woman to advocate for herself, try to join a high-risk program that a lot of hospitals have around the nation, and request genetic testing.
Of course, not all women have the same access to health care. What kind of barriers do you find that some women have?
So there are a lot of barriers, especially in certain communities. So one of the things Memorial Sloan Kettering has done is try to break those barriers and bring in walk-in mammography in Harlem.
Is hormonal replacement therapy still recommended for women in menopause?
It remains controversial. So if women are under the age of 60 and have many menopausal symptoms, hormonal therapy can still be recommended, but only for a few years. We are seeing some breast cancer in women in their 70s or 80s that are still taking hormonal therapy. So it should be used for an extended period of time.
All right, some really helpful information there, Dr. Pamela Drullinsky. We thank you so much for joining us.
Thank you.